Hello friends, welcome back to my channel Medicine of 101. Today we can say that the necrotizing enterocolitis. Okay, so from the term necrotizing enterocolitis, definitely the presence of necrosis. And enterocolitis means we can say in terms of the what is the inflammation of what intestine, right? So in a nutshell, if we just explain the word or if we define these two words, okay, together, then we can write it over here. We will get the acute what necrosis of the intestine. And whenever we are getting this type of the necrosis, these things develop for the unknown etiology, or you can say the idiopathic. This is the idiopathic, or we can have this type of the problem for an unknown etiology. So we can write it over here that what is this thing actually? We will get the acute, okay, necrosis of intestine for or due to unknown etiology, or regions, whatever you can say, unknown regions. Okay. Now there are certain kinds of the risk factors that can develop these things. Certain kinds of the or risk factors. Now, what are the risk factors related to this necrotizing enterocolitis? Let's know about them. So what are the risk factors? Let's use this color over here. So what are the risk factors? The first risk factor, there is a prematurity. There is a prematurity. That means in case of the you can see in most of the cases we can see the development of the necrotizing enterocolitis in terms of the preterm baby, and in few cases you can get also the development of the necrotizing enterocolitis. And for example, 10% the term baby, they can also develop the necrotizing enterocolitis. So you can write it over here. The risk factors for the prematurity. 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 This is a single most common cause. Single most common cause. Most common cause. Okay. Here basically we will see around around 30 to 32 weeks of the gestational age we will get the delivery over here. So we will get around the 30 to 32 weeks. 30 to 32. Within this time so we will get the delivery. At the time, this type of the prematurity that can cause the necrotizing enterocolitis, the most common cause. Okay. Now we'll talk about what are the secondary, what are the other risk factors related to these things. The other risk factors we can see over here. Okay, if we just see, okay, and another thing in terms of the term baby, or you can say the mature baby, we can also see, for example, the 10% of term baby they can also develop the necrotizing enterocolitis. Was the most common cause, that will be the prematurity, the single most or the greatest most common cause you can see over here. That's the prematurity. Okay, around we'll get 30 to 32 weeks of the gestational. In this time, we can see the development of the necrotizing enterocolitis. The second most common reason is over here. If you see the aggressive, try to understand what I'm saying. If you see the aggressive, the formula feeding, for example, the neonates, they are not getting the breast, they are not getting the mother's milk, or the we can say the breast milk. Rather they are given, for example, the formula, maybe the lactogens or maybe the other sources, okay, not from the mothers. So in these cases, if you see, there is a problem in terms of the aggressive formula feeding. Aggressive formula feeding. Aggressive formula feeding means, from here you can remember that things that maybe they are using the lactogen or the other things. So the third reasons we can say over here, the lack of breast milk, or you can say in another way, lack of breastfeeding. So I am writing it over here, lack of breastfeeding. These are the risk factors. And the number 4, you can say also over what are the more risk factors. We can say over here the fetal hypoxia. From the term hypoxia, that means what? Definitely the oxygen that will be less. So whenever oxygen will be less, try to understand there will be not productions of the ATP, the cells that will go under the necrosis process. So we can say from here the fetal hypoxia. Fetal hypoxia, okay. And another case we can get it over here. Number 5, I'm writing it over here. If we get, for example, the reverse or, okay, let's use this color over here. If we see the absent or reversed end-diastolic flow on antenatal USG. This thing is also the risk factors for necrotizing enterocolitis. So what did I say? What are the risk factors? The prematurity, the single most common cause that can cause the necrotizing enterocolitis. The second common cause we can say over here, the aggressive formula feeding. Instead of the breastfeeding, when the units of the individual the babies are supplied without the third reason I said it over here, the lack of the breastfeeding. The fourth reason here. And the fifth reason I said it over here, if we see the absent or the reversed end-diastolic flow on antenatal USG, if we get this type of thing, that can develop the necrotizing enterocolitis. Okay, now we'll talk about what is the most common place or the most common site on the intestine that will be involved in these cases. So the most common site, we can write it over with as the part of the intestine most commonly involved. And in these cases, the end-diastolic flow wire on, okay, umbilical artery. You can remember this thing. Umbilical artery. Okay, I am repeating once again this one. So if we see the absent or reverse end-diastolic flow in the umbilical artery antenatal USG, at that time we can confirm, we can be confirmed about necrotizing. Okay, if we get the absent, or reversed, if we get absent or reverse end-diastolic flow within the umbilical artery on the antenatal USG, at that time we can get the confirmations regarding what the necrotizing enterocolitis. Okay, and right now we talk about what is the most common site, the most common place of intestine involved in necrotizing enterocolitis, which is the most common part that is involved in these cases. So from these things we can write it over here. There's the, okay, let's write it over here, terminal ileum and ascending colon. Terminal ileum and the ascending colon, this is the most common site you can say within the intestine that can be involved in terms of the necrotizing enterocolitis. That's the terminal ileum and you can say the ascending colon. Okay. Now we'll talk about there are the different kinds of the stages. Okay. As far as the Bell's stage is concerned, we'll get basically the 3 stages for the development of the necrotizing enterocolitis. First we'll get the normal stage, then we'll get the mild, moderate. First we'll get the mild, then we'll get moderate, and the third we'll get the severe stage. What are the different kinds of the features we'll get in this case? Let's talk about all these things. Okay. So as far as the stage is concerned, okay, I'm showing it over here, guys. Whatever the problem we'll see. So this is known as basically modified Bell's staging of necrotizing enterocolitis. Modified Bell's staging of necrotizing enterocolitis. Now in these cases, we'll just know about what are the stages. First we will talk about the stages, then we will talk about the general features, then we will talk about abdominal features, then we will talk about investigation, then at last we will talk about the treatment. Okay. So first stage. Okay. At first we will talk about the first stage. That is known as, okay. So the first stage that is known as suspect NAC. if we suspect the NAC, necrotizing enterocolitis. If we see in this type of the thing, and whenever we talk about this type of thing, in this case is 1, 2, 3. In this case is basically we will talk about also 1A, 1B, 2A, 2B in this way, like 1A, 1B, 2A, 2B, 3A, 3B. Okay, or you can write in the Roman letter, and 3A, 3B. We'll talk about all these things in letters. Okay, we'll just mix up these things. Okay. And what about the general features we'll get? What about the general features? The general features we'll get in these cases, we'll get the temperature disturbances. Okay, the first clinical, we can say the general features in these cases. We'll get the temperature disturbances. Temperature disturbance. Along with that, we can get the apnea. We can get lethargy. And what about the abdominal features? In these cases, in the first stage, you can say the suspect NS in these cases will get the feed intolerance. The feed intolerance. Okay, you get the feed intolerance. Okay, feed intolerance. Okay. Now, what about the abdomen? If we in terms of the investigation, we will get when we are talking in terms of the investigations. If we just do the X-ray over here, if we just do the X-ray, mild dilation of the abdomen will get normal to mild dilation. Normal to mild dilations of the abdomen on investigations. Okay, this is the investigation. This is the treatment. Now, see, as I said in terms of the 1A, 1B, so if we see now the stage 1A, what type of the thing we'll get over here? Okay. So if we see that 1A stage over here and the 1B stage over here, in the same way we will get the 2A stage and the 2B stage also over here. Okay. We'll talk about all these things. Whatever the thing we'll get in terms of the 1A, we'll get the occult blade in stool. This is the first thing we'll get, occult blade in the stool. And the stage 1 we will get the fresh blood. Occult means we cannot see with the naked eye. Okay? This is the fresh blood, or you can say fresh blood in stool. So this type of the investigations we can do. So in terms of the stage 1, whenever you're suspecting the necrotizing, enterocolitis, and if we just do the investigations on the X-ray, we'll get normal to mild dilations of the abdomen. Along with that, if we classify stage 1A and 1B in these cases, in 1A we'll get occult blood in the stool, in the 1B we'll get the fresh blood in the stool. And as far as the treatment is concerned, whatever thing we'll get, in the treatment we have to use all the intravenous fluid along with the what? These things can be for the bacterial infections, so we have to use the intravenous antibiotics. We are not supposed to use any kind of the oral medicines over here. So we have to use intravenous fluid, we have to use the intravenous antibiotic, and with that we have to make sure that yes, we have to monitor or we have to observe the individuals for 48 to 72 hours. In these cases, whatever the thing we are supposed to use, in these cases we can use the intravenous fluid plus intravenous antibiotics. After that, we have to observe for 48 to 72 hours. And if we see any kind of the changes after on the basis of that, we have to change the medications also. This is the treatment. Now we'll talk about in terms of the stage 2, that is known as definite stage. Okay, so the number 2 stage, that is known as definite stage. What is definite stage? Okay, number 2 stage. In these cases, whatever problem we'll see in these cases, try to understand. Now, we'll get the, if we say in terms of the general features, we'll get the same features in terms of the suspect or the stage 1. So you can write it over here, same as usual as the stage 1. In terms of general features, same as stage 1. Okay, in these cases we'll get the general features. And what about the abdominal findings we'll get over here, abdominal features over here. Okay. Now, in terms of the abdominal features we'll get over here, we'll see one important thing, there is the absence of bowel sound. Absent of bowel sound. Along with that, we will get also another thing over here. Try to understand. In these cases, we will get also the abdominal dilations. Okay, in this case, we get also the abdominal dilations, but mild. So you get mild abdominal dilation. Or distensions, whatever you can see in these cases, no problem. That's the. Now, yes. What about the investigations? The most important one in terms of the 2A and 2B. 2A and 2B. Whatever the investigations we can do in these cases. See, in these cases, when we are talking in terms of this, so the definite stage of the necrotizing enterocolitis. In stage 2A, whatever the thing we'll get over here, we'll get the pneumatosis, what? Intestinalis. So what is this thing? So whenever I'm talking this term, okay, let's write this thing clearly. Pneumatosis intestinalis. Now, how can we define the term pneumatosis? How can we define the term pneumatosis intestinalis? In these cases, we will get the presence of the ear within the what? Intestinal wall. Normally, what do we know? There is the presence of the ear around the what? Around the intestine. But in these cases, we will get in terms of the pneumatosis intestinalis. In these cases, we will get the presence of the ear within the abdominal or within the intestinal wall. So you can write it over here. The presence of the ear. Presence of ear within where? Within intestinal wall. Intestinal wall. Okay, we can write it over here. And whatever the features we'll get in terms of the stage 2B. Now, if you write it over here, stage 2B, whatever the thing we'll get in terms of the stage 2B. Okay, in terms of stage 2B, we have to that we are doing. We are getting in these cases we'll get the portal vein shadow. So why these things we'll talk in details in the next part. Portal vein shadow. We'll get the shadow of the portal vein. Now, as far as the treatment is concerned, whatever thing we'll get over here. Now we have to use in the same way. We have to use what? Intravenous fluid plus intravenous antibiotics. And we have to give for example 7 days. For 7 days. And we have to see, we have to check the individual again. What are the problems again we are getting or not. So what did I say in terms of the definite stage, or you can say the second stage of the necrotizing enterocolitis, we will get in terms of the investigations we got it over here. There is the if we just talk in terms of this stage 2A, we will get over here the pneumatosis in terms of this stage 2A, we will get the pneumatosis intestinalis. In these cases, we will get the presence of the where within the intestinal wall. Along with that, we will get the portal vein shadow. We will get the portal vein shadow on the X-ray. If we just do the X-ray, we will get the portal vein shadow. Now, from these two, we can just do the investigations as far as the definite stage is concerned of the enterocolitis. What intestinal is what the necrotizing enterocolitis. Now, the treatment is same: intravenous fluid, intravenous antibiotics for the 7 days we have to give. Then we have to check it out. Now we talk about the third stage, the most severe one. So whatever the thing we will get is the advanced stage, or you can say the severe stage. It's better or you can write the advanced stage. Okay. You can write it over here. Let's use a different color for it. See, is the advanced stage. Advanced stage, or you can say the severe stage. Stage number 3. Stage number 2. Stage number 1 is already written. Which is stage number 1? Let's write it over stage number 1. Now, what type of thing we'll get in these cases? Features in these cases, we can get the shock, we can get the bleeding, we can get the recurrent, apnea. We'll get over here. We can get the shock, shock. Maybe the hypovolemic shock. We can get the bleeding. Along with that, we can get the recurrent apnea. Or recurrent life-threatening apnea we can get. recurrent life-threatening, okay, threatening apnea. Recurrent life-threatening apnea, we can get it over here. Now see, as far as the abdominal feature is concerned, we will get the huge distension of the abdomen in this case. If you see the abdominal features in this case, whatever thing we'll get the huge distension of the abdomen. Huge distension of abdomen. What are the features we'll get on the X-ray on the investigations? We have to know that thing also. Now again we can classify in terms of the 3A and 3B. Now if we just talk in terms of the 3A first. Okay, let's use a different color for it. Then I think it will be better. Okay, not this one. Let's use this color only. So talk about the 3A. Whatever thing we'll get the fluid around the what under the peritoneum. Define in terms of the peritonitis. Okay. Okay, we can use the what's the term? Peritonitis. Yes. Peritonitis. So we'll get the fluid around the peritoneum. Around peritoneum. And this condition is known as peritonitis. Peritonitis. Along with that, we will get the free gas, okay, under the diaphragm. In stage 3B, if we see whatever thing we will get in stage 3B, we can get the presence of the free gas under diaphragm. Now, as far as the treatment is concerned, whatever the thing we can use over here. Okay, I am writing it over here in terms of the treatment for this stage 3. So whatever the treatment you can do, you have to use the intravenous fluid, you have to use the intravenous antibiotics. As we are getting over here the shocking or the bleeding type of the conditions, we have to use over here the inotropes. Now see, I'll repeat once again. In terms of the stage 3, if we see the advanced stage of the in terms of the stage 3 is the advanced stage of the necrotizing enterocolitis. So the advanced stage of necrotizing enterocolitis is stage 3. Here we will get in terms of the investigations we will get, if we just classify in terms of the 3 and the 3B, in the 3A we will get the fluid accumulations around the peritoneum. We can just define the term peritonitis. Along with that, we can get also the free gas under the diaphragm. Now, as far as the treatment is concerned, we can use the intravenous fluid, we can use the intravenous antibiotics. Along with that, we can also use the inotropes, because in these cases, in the general features I have already explained you, we can get the presence of the shock or the bleeding in these cases. That's why to maintain this thing, we have to use the inotropes. Okay, so that's all in terms of the necrotizing enterocolitis. This is the what? Risk factors, where we will get the most common site, and whatever the stages we will get in these cases. This is all of these things. So if is the topic from the aspects of the pediatrics over here. So if you think that this video is helpful for you, please do like and subscribe my channel, and see you in the next video with the next topic, interesting topic. Okay, see you next week.